All right, today we are going on a journey, a really deep one, right inside the human body. We're going to explore one of the most incredible tools we have for understanding our most vital organ, the heart. So let's jump right in. I mean, think about it. How can we actually see a heart in action while it's beating without, surgery? For centuries, that was a total mystery. But what if you could create a detailed, moving portrait of it, safely, non-invasively? Well, that's the exact challenge that modern medicine has cracked. And the answer is cardiac magnetic resonance, or CMR for short. And no, this isn't science fiction, it's real. It's this incredible technology that uses super powerful magnets and, here's the key, not x-rays, to give doctors an unbelievably clear picture of the heart. We're talking structure, function, the whole shebang. It's safe, it's precise, and it has absolutely changed the game in cardiology. Okay, so what can this machine actually show us? Let's dive in and take a look at the kind of portrait it can paint of the heart. I mean, the amount of information a cardiac MRI can reveal is just incredible. We're talking about looking at the heart's basic function. How well is it pumping? It can spot damage from a heart attack, it can identify different diseases, and it can even find congenital defects. The level of detail is so good that surgeons use it to plan out complex procedures. It's really like an all-in-one diagnostic powerhouse. So that's the tech, which is amazing. But what about the human side of things? What's it actually like for a patient to go through one of these scans? Let's walk through that experience. Every single step in the prep process is all about getting the clearest image possible. First off, they place special electrodes on you. These are totally MRI safe, of course, and they're there just to monitor your heart's rhythm. Then, you're positioned very carefully right in the center of the machine. This is super important to avoid any weird distortions in the pictures. From there, the machine actually syncs up with your heartbeat, timing the images to happen between beats. It's like freezing motion to get a perfectly sharp photo. And yeah, you'll be asked to hold your breath for short bursts. That's just to keep everything as still as possible. And really, all of that careful work, it's all for one big reason: to get the most precise diagnosis possible. It's all about getting rid of any little variable so the images are as sharp and accurate as they can be. That's what leads to a diagnosis you can be confident in. All right, so we know how the patient gets ready. Now let's talk about the machine itself. How does it actually see? The best way to think about it is like a high-tech camera with a bunch of different lenses, and each lens is designed to capture a very specific kind of picture. So here are the two main lenses, and they're pretty different. On one hand, you have the bright blood technique, and just like the name says, it makes the blood show up as bright white. This is perfect for watching how blood is actually moving and flowing through the heart. Then you've got the black blood technique. This does the opposite. The blood appears dark. And why would you want that? Well, it creates this amazing high contrast image of the heart's anatomy, the walls, the muscles, the chambers. Doctors will use both to get the full story. But wait, there's another technique that is honestly kind of magical. It's called late enhancement. Here's how it works. After a special contrast agent is used, this technique makes any scar tissue in the heart muscle, fibrosis from past damage, it makes it light up, just glow brightly on the scan. It literally lets doctors see the history of the heart, the invisible damage left behind by a heart attack or a disease. This is absolutely critical for figuring out the best treatment. Now, these techniques are already revolutionary, right? But the technology is not standing still, not even close. So let's look at the future of imaging, because things are getting even more incredible. Okay, first up is a huge leap forward called compressed sensing, and this is a total game changer. Basically, it uses these super smart algorithms to grab the images way, way faster than before without losing any of the quality. And to really get why this matters, you have to look at how things used to be. Not that long ago, a cardiac MRI could take anywhere from 40 to, get this, 70 minutes, and you'd have to hold your breath again and again. It worked, sure, but it was long and it was tough on the patient. But now, with compressed sensing, that whole process is completely different. We can get these beautiful, high-resolution images in just seconds. And a lot of the time, the patient can just breathe normally. This makes the whole exam so much faster, way more comfortable, and it opens it up to people who just couldn't handle those long breath holds before. And if that wasn't enough, there's another incredible advance called 4D flow. Look, if a regular MRI is like a photograph, 4D flow is a full-on movie. It shows blood flow in 3 dimensions, plus the 4th dimension, time. You can see everything, complex patterns, turbulence. That analogy is perfect. It is literally like watching a real-time weather system of the blood moving inside the heart. You can imagine how crucial that is for understanding really complex diseases. So all this cool tech,
Faster scans, better images. Why does it really matter? Well, it's fantastic, but the true value here, it's measured in people's lives. Let's talk about where this technology makes the biggest difference.
Just look at this number, 30,000. That's how many children are born with congenital heart defects in Brazil every single year. It's a staggering thought. And for these kids and for their families, having access to accurate and safe imaging isn't just a nice to have. It's an absolute lifeline.
And this is exactly why cardiac MRI is so critical for these young patients. For one thing, it gives you the whole picture, the anatomy, the blood flow, the function, all in a single exam. But maybe most importantly, it does it all without any ionizing radiation. That is so crucial for kids who might need many scans over their lifetime. And for surgeons who are treating these incredibly complex conditions like tetralogy of Fallot, this technology gives them the precise, detailed map they need to plan out a life-saving surgery.
So when you think about it, for these patients, a cardiac MRI isn't just an image. It's so much more than that. It's a roadmap. It's the guide that doctors will use to plan their care for their entire life.
Which really brings us full circle. In just a few short years, we've gone from a still picture to a full 4D movie of a beating heart. It really makes you wonder, doesn't it? If this is what we can see today, what on earth will tomorrow's technology allow us to see, to understand, and to heal?